Hi, everyone. Welcome to the 13th episode of the podcast series featuring interviews with women who stammer, sharing their inspiring stories with others. My name is Vidya Lalgudi Jaishankar. I am an artist and a volunteer at TISA. Today, our guest is Dr. Neenu Oliver John. She is an associate professor of radiation oncology at Christian Medical College, Vellore. She specializes in the treatment of gynaecological and colorectal cancers. She has presented her research at prominent conferences such as the Association of Radiation Oncologists of India and Indian Cancer Congress. She has received prestigious grants from the Indian Council of Medical Research and FLUID and authored several publications in the field of oncology. Additionally, Dr. Neenu is a person who stammers, and we are excited to explore these aspects of her life and how it has influenced her experiences in the medical field and also her approach to patient care and leadership in research. Hi, Dr. Neenu. Thank you so much for taking time to do this interview. It's a pleasure to have you here. So could you share about your educational background and what motivated you to pursue oncology as your specialty?
Hi, Vidya. Thank you. It's a privilege and honor, I think, to be part of this big organization called TISA. And I'm so glad I found this few years back. I would say it was much late in my age, I think much beyond my M.B.B.S times when I actually found TISA. So I'm very thankful to Sachin sir especially. Yeah, so about my educational background, so I think I did, basically I was brought up in Chennai, and my parents were college teachers, professors and lecturers. My dad used to work in Madras Christian College at Chennai. So my primary schooling was inside the campus itself, Madras Christian College campus. Then my plus two I finished from a convent in Chennai. And then I got into M.B.B.S in Vellore, KMC Vellore. So then I finished my M.B.B.S. And after that, I worked into rural hospitals in Kanchipuram and Nagari. Nagari is an area which is a border between Andhra and Tamil Nadu. So these are rural areas which are under the Madras diocese, of the church sponsoring body in Chennai. So then, because I was sponsored by them, I had to work there. So after I worked in those rural hospitals, then I got married. Then I did my PG post graduation, which was MD in radiation oncology. So why oncology? So yeah, basically my mom was diagnosed with breast cancer, and by God's grace, successfully got treated, and she's a breast cancer survivor. So I think that was my closest experience with oncology. So that was one thing. And as many of the PG aspirants would know, once you finish M.B.B.S, all of us are in a crossroads. Which PG to choose? Okay, that is one major question all of us go through. So we kind of ponder about our plus points, minus points, what is our interest, all that we look through, and then decide which is better. And then obviously the marks, all that together. So then I realized I'm not interested in non-clinical stuff. I wanted to interact with patients. So my strong point was not microscopes or teaching or not anatomy. I wanted to interact with patients. So that I was very clear. So then we were just cutting each option. And then finally, I think radiation oncology was my choice. One thing was because I wanted something as end specialty. I don't want to continue studying as DM and all that. So I didn't want to continue my whole life studying. So I wanted to finish something in specialty. So that was the other thing. And so I actually made 1 week observership. I worked, like, actually visited the department 1 week, saw how it is. And then I worked with them for 6 months to see if it really fits me or not. And I realized I actually liked it. And it's not too busy, and I'm able to do a work-life balance, even though during studying MD, it was very busy. Day and night we had to work, long duty hours. Midnight we used to go to department and finish our work. So busy, it was so hectic. And like, I was married by then, had my daughter also by then. So it was very difficult to balance both. But finally finished, and after finishing, it's better. So the work-life balance, what we usually call, nowadays. So
Yeah.
work-life balance better after finishing. So during training course, I think it was really busy. That's what
Yeah.
I would say. So that is my career. I mean, like, education background. Anything else you want me to tell? I'm not sure
Yeah,
what
you can,
exactly.
I mean, there are questions, a lot of questions I have to ask you, so you can share more about your journey in that.
Yeah, yeah, definitely.
Uh,
So, yeah, that
yeah,
is about it.
thank you. Thank you so much for sharing your journey into oncology. I mean, I can clearly understand the passion and the dedication you bring to your work. I mean, I think your experience with your stammering would have had some kind of, contribution in, I mean, both in positive and negative ways along this journey. So, going back to the time where you first experienced stammering, how was the support system back then, and how has it changed over the years?
I think from the time I was maybe 7, 8 year old, from the time I remember, I think I was stuttering. Yeah, I don't really remember the first day. So some vague memory of fourth standard, maybe fourth grade, third grade times, when I was asked to read in the class, I was repeating, there was blocks and all that. So that is my vague memory. And in my fifth standard, I remember I had to talk some lines in front of an audience during a Christmas program at school. So then I really vividly remember that I had a lot of stuttering and blocks and hesitations. So back then, my like, class teachers and principals were really helpful. They had, I think, really a positive impact, I would say. So they identified my problem then, and they actually introduced me and my parents to a speech therapist in Chennai. And I still remember going from home to meet that speech therapist. I still remember that room, one old man sitting there. Old man, since, like, obviously he was a very, what do you call, experienced speech therapist. So in Chennai. So then I went and sat with him, and he asked me what's my name. So usually name is the most difficult part for all of us. So so we actually figured out all sort of mechanism. Uh, 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 how to, like, change our name or say some vowel in front or anything like that, different coping mechanisms. So yeah, so then that started. After that, he said, blow a balloon. Can you blow a balloon? And I said, no, I can't blow a balloon. That is something even now I can't blow a balloon. So then he said, okay, there's nothing wrong with you. All you need to do is just talk slowly. And every day you can practice reading newspaper, maybe 4 or 5 lines every day. You just do a sing-song method, you read. That's all. You can go. So then we back home, maybe first 2, 3 days I did. After that, again, it just fizzled off. I didn't really continue, and I think I didn't really find a, what do you call, logically impact in that. By just reading a paper, how can it help? Just reading for 10 minutes, how can it help? Maybe I was wrong a bit, but still, yes, we all know we need to slow down, prolong. All that definitely helps. But still, as a 8, 9 year old, I think it didn't make sense, or maybe the way he spoke to me was very detached. So probably all that also, I thought he
Yeah.
doesn't understand what is the actual issue. Only I know. None of you understand. So that is the way I think I had in my mind back then. So then, even in my seventh, eighth standards, also I remember going to another speech therapist, then having one phone conversation with a speech therapist, another way, then another psychologist. So then all relaxation techniques she taught me, how to relax and all that. So all these had some effects here and there, I would say. It helped me to learn some techniques here and there, but still it didn't really, what do you call, address the root problem, which is self-acceptance.
Yeah.
And to so that I don't think they really addressed. So that is one thing I was thinking. Then after, so through it all, my parents, my brother definitely were very, very supportive, I would say, in their own ways. Obviously, they also didn't know the actual methods of supporting, I guess, which is the right way, not to stop
Yeah.
me, not to help me complete. All that I think many people don't know. So my friends and my what do you call cousins, relatives, all of them were helpful. I would say maybe very rarely some people might have made fun that I don't really remember much. I think thankfully I was blessed with good loved ones who really supported me. I would say, so that's a blessing only I should say. So then after school, so then yeah, the struggles in I think schools, I'm sure all of us might say this roll calls, no? For
Mm.
attendance. I used to hate it. They'll ask to either call your name or
Yeah.
say present or your roll number.
Oh, yeah.
We used to
Plight of every
I
person
know, I
who
used to hate
stammers. Yeah.
yeah. So, and as always, like good hair days, bad hair days. Similarly, good speech days and bad speech days are there. I'm
Mhm.
sure all of us will actually accept to that. So, actually agree with me that there were some days when I'm really trying to talk. There were some days when I could answer my roll call very well. Some days it's a huge struggle. So, all these were part of the journey. And in school, there were many days when I was very, very, very upset or depressed, all tears, crying in the room, so many things, crying to my mother or crying alone, all those things that happened. There were days when I was on top of the world.
Yeah.
So it's been both. And yes, and there were also sometimes at school when they would ask to read as interns, and then you
Yeah.
would just don't, meaning part of me wants to read. But then obviously part of me didn't want to get embarrassed. So
Yeah.
didn't want to go through that embarrassment situation. So some good meaning teachers will say, okay, you don't read, skip. But that in a way had a negative impact. I didn't
Yeah.
feel good finally.
Yeah.
So you don't want to be skipped. You don't want to be
Exactly.
you don't want to be skipped. You want to do
Yeah.
everything as anyone would be doing. There is nothing wrong with you. You just have some repetition, some blocks. That's all. That actually everyone has that.
Yeah.
It
Yeah.
just us, it's more we kind of tend to give a negative feedback mechanism on it and we repeat it. That is the issue.
Yeah. Yeah.
When we are asked to read to ourselves alone, we're able to read well, you
Yeah.
know.
Yeah.
So if there's something abnormal, it should be there everywhere, irrespective of the situation.
Yeah.
So if there's something ingrained abnormal, it should be there anywhere and everywhere. It should not be
Yeah.
when you're alone, you're not like, no, you should be stuttering and blocking and repetition. All that
Mm.
should be there when you're alone. So that's not the case. So definitely it is something a self-learned habit with
Yeah.
some sort of what do you call mechanism which is our own mechanism which we've developed. So
Yeah.
definitely it won't limit us. So yeah. So in school, so that is each of these therapies help me here and there to like get over here and there, I would say. And but then I did do like plays or even vivas or everything whenever I could, because each time teacher would tell the examiner, okay, she has some problem. So they would just go and whisper next to them, say something. I understand the teacher is telling the examiner. So part of me feels okay, relief.
Yeah. Yeah.
Cool, I'm saying. So
It's so,
then got
yeah.
over.
Yeah. Our entire world revolves around stammer at that time? You know, when you said like you felt
One
at
thing I
top of,
keep
yeah,
telling,
yeah,
yeah, that we shouldn't let the stammering limit us.
yeah, yeah,
I mean, I keep telling myself, as I'm telling this, I'm telling myself also that I shouldn't let the stuttering define me
yeah,
or limit me.
yeah,
Yes, I do stutter. So what?
yeah,
That
exactly.
shouldn't be limiting me. So that is the only basic thing.
Yeah.
So I think nothing should limit because I stutter, I didn't do this, or I couldn't do that. It shouldn't be.
Mm, mm,
At
mm,
the end of
mm.
my life, I should be able to do everything. I should have been
Yeah,
happy with everything what I want.
yeah, yeah, absolutely.
So
So,
that was yeah.
yeah.
And college again, basically, I think till plus two it was okay because you're all in a gang, you're in a class,
Mm,
not everyone is asked to talk in front or present, at least those times. So it was okay. And I used to choose all this dance and singing, which I was very happy with. And I learned Bharatanatyam also. So, I used to go for dances, not for debates. I used to go for singing, not for plays. All those things I used to choose like that. So, but then I was happy with it. So it just got masked, I would say.
yeah.
So maybe it was good in a way. I'm not very sure about it now. But when I entered college was the shocker because you need to have case presentations in college in
Mm,
M.B.B.S. So each of us had turns to talk to the patient, work up, and then present in front of your group. So that is part of the learning. So that there is no way I can escape. So
yeah.
then came
Wow.
the shock again. I had to go through and face. And one speech therapist helped me out that time, I would say, who was not a speech therapist. She was also a person who stuttered. So she
Yeah.
had a way of handling me very well, I thought, to just talk to me, to let me like help out with some techniques also. And at the same time, she could actually listen me out and not just say you read or you do this or you do that. So she kind of walked with me, I would say about a year maybe. She was there on and off. I used to meet her. So that really helped me. And then she had to leave. So I remember when she said she had to leave, she is going abroad. My whole world started crumbling, I
Oh,
thought.
I understand. Because it's so rare to find a speech therapist who also stammers. It's such a
Exactly.
blessing to have that
Yeah.
person with you. Yeah, I can completely understand. Yeah.
So that, but then again, I like remember telling myself that okay, why? Okay, so what if she leaves? She is not my crutch. Okay, she helped me out. Now, like I need to live my life, so I need to make a decision. Whatever I've learned, I need to practice. So that was one decision. It was a phase again. So that was during my M.B.B.S, I would say. So again, all my friends and family were really supportive. They really helped me.
Wow. It's nice to know that you had support system, you know, thriving all these years, which is wonderful to hear. Thank you
Yeah.
so much for sharing this. Could you explain in simple terms what gynecological and colorectal cancers are?
Yeah, so
Yeah.
gynecology, as all of you know, it's about women reproductive organs. So the actually cancers which affect the reproductive organs like the uterus, the womb, or the ovaries, fallopian tube. So all these organs, when it gets affected with like cancer cells, that's called gynecological cancers. So it's a like complete package of all these. So and colorectal cancers are mainly the cancers which affect the intestines, big intestines, small intestines, all the parts of the intestine. So the malignancy which affects any part of the entire intestine are the colorectal cancers. So each cancer in each part behaves differently, and
Okay.
the way we manage them is also different. Some
Okay.
need surgery, some needs radiation, some needs chemotherapy. So it's all different.
Okay.
So yeah,
Okay.
that is maybe the basic thing I can
Yeah,
say.
thank you so much because it makes me understand a little bit more, I would say. So I can imagine that when patients receive these kind of diagnosis, it can be really overwhelming. So how do you approach conversations where patients need to understand complex medical information while also they should feel heard and reassured? So as your experience with stammering influenced how you navigate these sensitive conversations?
Definitely, I would say. So actually being blessed with stuttering, sometimes I feel stuttering is a blessing in a way.
Yeah.
It has its positives and negatives. Negatives all of us keep saying, that all of us saying and knowing. But then positives are definitely, it makes me a more empathetic person. I'm able to talk to a patient with empathy. I'm able to listen because I
Yeah.
know the importance of listening, being listened.
Yeah.
No, because I'm sure all of us would have gone through experiences when we have not been like, heard, listened patiently. We say, what's the hurry? Just listen to me.
Yeah. Yeah.
Like that. So I'm sure the patient might also feel the same. So to listen, even though like the OP might be busy, might be a long waiting list, whatever, but each patient needs to be listened to. So
Mhm.
that intuitively we know. So, so that is like goes without training, I would say. We just know it as back of a hand. So
Yeah.
that is actually like definitely has helped me, and it has shaped me to be a better listener to the patient. So that is one thing. Then the other thing is to explain to the patient. So I know I need to slow down,
Yeah.
to be clear. So that it actually has a good effect, when I
I
slow down and
understand. Yeah.
so
Yeah.
that also has been positive, I would say.
Yeah.
My
Yeah.
patients are happy. Yeah, to be honest, not about boasting. And the same patients are happy. They say, "Okay, okay, I'm feeling very relieved."
Mm.
Many patients say that, even Hindi patients, even if I don't know the language, we see Bangla patients, Telugu patients, all states come. So even if I don't know the language, some words here and there we just speak and they are very happy.
Wow.
So the patients, when they are just listened to, they are actually like they feel relieved. So that is one thing. And because of stuttering, I'm able to slow down and make it into simple words and wait and talk to them. So, and explain to them.
Yeah.
So, yes, so all that has definitely helped, I would say, in being sensitive to them, being empathetic to them, being understanding to them.
Wow. Thank you.
It is a learning, it is a journey. I'm not saying I achieved perfection, but I'm saying
No,
all this happened.
but it's good to highlights the positives because we as as a person who stammers we tend to focus only on the negatives of stammering.
Definitely.
Yeah.
Actually, in medical terms, Hansen's disease, leprosy. Leprosy, I'm sure all of you would know. Leprosy, you would have seen, people who don't have fingers get eaten up, ulcers. So there, the issue is about they don't have sensations. They
Mm-mm.
don't have pain. So there's a book written by actually Yancey that the actually gift of pain. So pain is so important. We realize that pain is so important when there is no pain.
Yeah.
That is what actually happens in leprosy. So those people don't have pain, so they don't realize they get pricked with thorns or anything, there'll be ulcers, bleeding, they won't realize. So
Mm-mm.
in the same way, I would say it's a blessing in disguise in a way. So it helps me keep me grounded, keeps me humble.
Yeah.
So all that is kind
Wow.
of goes in the underline.
Yeah, 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 yeah. Thank you. Thank you so much for sharing. Yeah, I'll go to the next question. Mm, Self-advocacy is important for anyone who stammers. So, how do you encourage patients, colleagues, and students to be understanding of your stammer? And what advice would you give to those who are hesitant to, to share their needs to others?
I think self-advocacy part, I've not been very good, to be honest. I haven't, meaning whenever I've got classes or any lecture or anything, I don't think I have disclosed in the beginning that I do stutter. I haven't done that so far. So
Okay.
I do feel meaning that self-acceptance part is a struggle. So sometimes, some days you accept, some days you don't.
Mm-mm.
So, and I don't want to really what do you call announce it when I know anyway 2 lines when I'm going to talk, they're going to see me stutter.
Yeah, yeah, yeah.
So that is what is my way. I'm not saying that is the way. I'm sure because many people do say you need to disclose in the beginning. It helps. So that part I have not reached yet, I would say.
Yeah, I think
Um,
like it depends on people also, like in the sense like some people feel that it is a relief to tell others.
yeah,
Uh,
that's what
so
depends
if
from
that,
person to
yeah,
person
yeah,
and
exactly.
also the situation you're in, I feel.
Yeah,
Even
yeah,
things you have some journey, it's one up and down, I feel. It's not a
yeah,
flat.
yeah,
Okay.
yeah,
So it is like ECG, I always call it. It's like ups and downs. If it's
yeah,
a flat plan, you're a dead person. So it
yeah,
has its up and downs, similar to
yeah,
ECG. You're also having good days and bad days. So
yeah.
sometimes, anyways, people will get to know. And yes, when one-to-one conversations, people have asked me that,
Okay,
like, have any you've got an issue with speaking? Do you have an issue like that? People have asked me. So then I say yes. So even to say yes, I found days when I cried.
okay,
Some days when I said
wow,
yes happily
yeah,
and
yeah,
just brushed it off like a normal conversation. So at school, I remember when my mom asked me, teacher asked me, I just cried and howled.
yeah,
I
yeah,
didn't know how to express it, I guess. So even in college, I remember crying. But nowadays, I think I've gone past it. Sometimes I feel age does help, no? Age helps. Also, actually achieving helps. Getting
mm,
things what you want, what you worked hard for.
mm,
All that actually helps, I feel, in getting a what do you call control of yourself and to have your own self-worth.
yeah,
That's more important, I would say, because self-worth is what is lacking many times. We feel stuttering just defines us and the whole world crashes down, but it is not. That's not the truth. So when you have a self-worth which is important, which is needed, then everything else comes in its right places. Okay, I stutter. Fine. So
yeah,
what?
yeah,
That will be
yeah,
one part of it.
yeah,
So yeah, so self-advocacy part I've not reached, but when people do converse, I have really discussed. And
yeah.
sometimes when people advise, I get to put off also. I get angry. I don't.
Yeah, that happens, you know. They will give all kinds
You
of
should do
advices.
this. Like, you don't know anything. You have no
Yeah,
idea.
yeah, yeah.
It really helped me, I would say, to see people to talk about it because in reality, who have really going through the same problems or same issues in life. So that was a real eye opener, I would say, with TISA. It really
Okay.
helped.
Wow.
Really.
Wow. Thank you.
Actually, one of my most depressed times only when I was Googling, I actually found TISA in my
Wow.
college.
I can understand, like, you know, Tissa's, yeah, for me
That time,
also.
WhatsApp was not there. So it was in my M.B.B.S times. Yeah, in my
Okay.
final year, I think. Yeah, I was just Googling this so desperate. I was so angry and irritated. That's when I found this and I mailed and
Wow.
thanks for
Tissa,
this.
yeah, yeah.
And
Uh, thank you. Yeah, you were saying?
UPG also really helped, which was 2 years back I joined.
Okay.
Yeah.
What?
UPG really
Oh, TOPG. Okay, sorry, I couldn't hear you properly. Yeah, yeah.
21, I think I joined.
I think
And
now they have started
I
another
saw that.
TOPG.
What is the
Yeah,
best? Yeah.
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 I have
It was
enrolled.
good. It was really good.
Yeah, wow, wow. Nice.
And
Um,
those phone calls, all those activities what they make us do. I think it's
okay.
really
Yeah, 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 right. Yeah. And
really.
then
These are the actual needed therapy.
yes.
This is what is required, not just something is put pebble in your mouth. All those things. Yeah, I've been told all that also.
Yeah, I can understand. So my TOPG is starting. I mean, the next TOPG starts on 20th. So I have joined. So I'm very much looking forward to it. So the next question is, in your role as an associate professor, you mentor and lead others. So are there any moments where you have to balance between vulnerability and strength in your leadership? Because stammering in itself is a constant interplay between these two. So please, if you can share your experiences in that.
Definitely, every minute, every day is a constant struggle only, I would say, between vulnerability and strength. So be like leave alone leadership. I think just at home, with
Yeah.
friends, with conversations, anywhere and everywhere is a struggle. So where is the strength? Where is the vulnerability? Is a thin line. So the vulnerability is the strength. Strength is the vulnerability half the time.
Yeah.
So leadership point of view, meaning mentoring students, mentoring like postgraduates. So one thing is, as I said, even like as with patients, even with postgraduates and students, it gives me the sense of empathy to listen to them. So that really helps. And to share my vulnerability when it's needed.
Yeah.
Because I think we need to maintain the hierarchy. So
Mm-hmm.
I cannot be too vulnerable with my students. So that is there. At the same time, yes, yeah, I do like advise them, tell them that all of us have our struggles. You need to like, you need to overcome yours, I need to overcome mine.
Yeah.
So
Yeah.
indirect statements. So such statements I do talk to people one on one. So all those things, yes.
Oh,
So that's how I think leadership with vulnerability and strength is definitely a ongoing journey.
yeah.
I need to gain more and more of it, more strength in it, I would say.
Yeah.
But then, yes, even my postgraduates or the students also do see how I handle, so by seeing also they learn. So, yeah.
Yeah, when you show your vulnerability, they also becomes much more open and perceivable in a way, like, they will share their strength and weaknesses also, which gives a very honest conversations and other profound connections. Yeah.
Yes, definitely.
Yeah. Yeah. Yeah.
Graduation training itself is a very highly stressful period in our life of a doctor.
Yeah.
Whoever's gone, no. So in that situation, it's very difficult. So when somebody is there to talk, listen, they feel it's very relieving and a strength for them.
Yeah. Yeah. Thank
So,
you. Thank you so much. So my questions have come to an end. So I would like to invite our audience to share any comments or ask questions. Yeah.
Hello,
Hi. Hello.
am I audible?
Yes. Yes.
yes,
I'm talking from Maharashtra. I'm working as professor. Here
hello,
is
sir.
at one college is there, agriculture university is there. So I'm trying to cope up with the stuttering issue, and the teaching and doing my research work. So I want one question. I will not take more time, but one question I want to ask you, that it's my personal experience that that if I'll take some sort of sleeping pill and at the night, and suppose there is presentation, some sort of research presentation, whole day presentation is there. I have to talk for 4 hours together like this, and will take some sort of sleeping pill at night, and then the next day is very much smooth for me. So is it right to take such type of thing or not?
So yes, sir, very much
Sedative. Some sort of
sedative. Yeah.
light. I have 0.25 mg.
Understood that, sir. Yeah,
Yeah, yeah,
yeah.
yeah, yeah.
Yeah, I know that many people do advise low dose sedatives.
Yeah, yeah.
Like especially before a stressful day. So it is mainly for the anxiety part. It doesn't
Yeah.
actually help in the stuttering. It doesn't treat the stuttering. It treats the anxiety. So it's not just for stuttering. Even for anyone else also, if they've got any like anxiety issues, they can take. So it targets the anxiety, not stuttering, but because it targets anxiety, in turn it targets the stuttering.
Yeah.
We see it
Because the
goes
root
better because anxiety levels are less. So that's all
because the
it is. Yeah.
root cause is like anxiety, na? Suppose we have to talk something like abrupt talking, that there is meeting something and we have to explain something abruptly, instantly. So then there is a lot of the stuttering is there. So if we are they must calm and composed mind, then there is no stuttering. There is no like a stuttering. So if we could make ourselves calm by meditation or medication, then I think so there is reduction in the stuttering. I don't know. I have just recently joined TISA, so I am working a lot on that. I'm chanting Bhagavad Gita slokas also in the morning. I'm doing everything possible.
We understand that, sir. All of us, I think, go through this journey with stuttering. So definitely, I would say this for the anxiety part, it helps. But then we should not go with a wrong message that like taking
Yeah.
sedative for stuttering helps. No, that's not the medicine for stuttering. Definitely no. Stuttering is not a disease. It's
Yeah.
not. No, it is a like speech disorder, yes, which can be controlled. Which
Control, but it can't be
can be
cured from.
controlled to the maximum because even every human being does have some level of stuttering here and there. They do repeat syllables. If you actually watch people talk, everyone will have repetitions, blocks,
Yeah.
repeat a word or syllable or anything, using words in between filler words, especially with in a stage or while talking, while presenting. There are more. Many people have them. But we don't call them stutterers. But we call ourselves stutterers because we have told ourselves it is, we are defined by it. And
Yeah.
we've let it define us. That is the main issue, sir. But I agree if there is an anxiety issue which is diagnosed by a psychiatrist for the anxiety, anti-anxiety medicines do help. But definitely it's not for the stuttering. But that anti-anxiety medicine might have an indirect effect. That's all.
Indirect.
But definitely there might be side effects. So we cannot
Right.
say for stuttering you can take no.
No.
No, that is a definite no.
Thank
But there's
you.
Okay.
something taking
Okay.
for
Thank you
the
very much.
anxiety. Helping you is good, sir, at low doses.
Yeah.
Okay, man. Thank you very much. Thank you very much.
Thank you so much, Dr. Neenu.
And
Yeah.
Call me Neenu, please.
Okay.
very glad to talk to her. Really nice.
So much. Me
Thank you.
too.
Thank you, Vijay, for asking
Yeah.
this question. Yeah.
Yeah, it's a very relevant. I'm sure all of us have gone through these. Actually, one of my
Yeah.
psychologists actually advised me to take, and I said no. I said
Yeah.
I'm not going. I don't want to
Yeah.
take.
Yeah.
So, because I
Self-acceptance.
know that is not the issue. Meaning, I know the medicine shouldn't be controlling. No, fine. I don't want that. So, yeah. So basically, I think, it's fine. If there's anxiety disorder, anxiety issue, yes, not for stuttering.
Yeah,
That should be clear.
self-acceptance in a way, like it makes us, when we accept ourselves, we don't care about what others are gonna think. So that particular aspect itself will take away all the anxiety, because the anxiety is about that, not about actually when we stammer. That's why we don't stammer when we talk to
But
ourselves,
then,
right?
having said
Yeah.
that,
Yeah. Right.
sometimes there might be a medical condition. There might
Yeah.
be a condition of anxiety which might be along with stuttering, probably. So that a psychiatrist need to see,
Yeah.
diagnose, and treat. We can't self-medicate. So
Yeah.
self-medicate. So
Yeah. Thank you. Thank you so much. Uh, Yogeshri has asked, like, are there any quick tips or techniques I can use when I feel nervous or start stammering? Yogeshwari, sorry.
From TISA itself, we actually learned the 4 techniques, right? Pausing and prolonging and bouncing
Bouncing.
and voluntary stuttering.
Yeah.
So these 4, I think, definitely helps.
Yeah, yeah,
Breathing, I don't know. Breathing helps, but finally I'll be like, panting and huffing only before a presentation. So I
yeah,
think, also helps. I'm not really making fun of it, but then all these need to be there. These 4 techniques definitely helps. Pausing, definitely, which I also didn't use now when I was stuttering. I also didn't use. Then smiling, yes, that's one thing.
yeah,
Smiling,
yeah,
smiling.
yeah,
Stutter with a smile.
yeah.
So
Yog
smile.
yeah,
And
Yogeshwari is, sorry.
uh,
Yeah,
yeah,
please
stutter with
continue.
that's what so those are the things I think, because the ease with which we stutter, those things are important. So, to relieve ourselves of the stress, of the muscle stress and tightness, the ease with stuttering. That's what we need to aim at. That's all. Then we'll be fine.
Yeah,
I mean, it won't bother us. That's all. I'll be still there. I'm not saying it'll go away.
yeah, yeah, yeah. You're absolutely right. So, are there any other questions from the audience? Like any comments you want to share?
Vidya, I had a question for Madam.
Yes.
Uh,
Hi.
Hello. Ma'am, I just wanted to know during your journey, basically what we learn in TISA is self-acceptance of stuttering, right? And stammering. But I feel that the acceptance by the society, the way we are, is more important. So, how did you find in your journey, like acceptance of the way you were by the society or those who were your peer colleagues and all that? And don't you think so that acceptance by then gives
Very
us more
relevant, important.
confidence? What is your I can say, what is your experience about it?
Thank you, ma'am, for asking. The root cause of issue. So we cannot change the society. Let's come to terms to that. We are not like superheroes or like Avengers to save the world or change the world. But we have the power to change ourselves, have the control in ourselves. So first of all, the confidence and the acceptance is in us. We cannot change how XYZ will accept me or not. It doesn't matter. First of all, it doesn't matter if XYZ accepts me or not. What matters is me accepting myself. First of all, accepting the stuttering, accepting as part of me, that itself gives me confidence. This is one thing. The other thing is, if you're trained, suppose if you're a professional, if you're studying for something, do it well. Do it like cent%. Give your 100%. Do it well. Excel in what you're doing. Then people will see your work. People will see your caliber, and the stuttering gets minimized. Caliber gets maximized. So even your colleagues, research colleagues, or your whoever it is, they see your work. Even in KMC Vellore, I know many doctors who do stutter. There are doctors who stutter, there are people who do stutter with different intensities who have actually achieved lots. People don't talk about their stuttering. People talk about their work. So when we maximize our work, our caliber, then people also see that and accept that. There might be some people who still like to talk, oh, hey, he's not able to talk. Doesn't matter. They don't bother in our lives. They don't
Yeah.
matter. So that is the way, and definitely give your best at work or wherever we are, so that people are not able to find fault in your work. Then obviously, yes, nobody can say you are being less, less skilled or less qualified. No, just because somebody has some stuttering doesn't mean they are like less, less in any way compared to another person, another employee who is not stuttering, who will also have stuttering 5%. I might have 80%. That's all the difference.
Yeah.
First of all, we need to come to terms with that everyone stutters.
Yeah.
And the fact that society needs to accept me, I think that I think that shift has to happen in my mind. That that my focus needs to be on me and not on the society. If that shift happens, automatically society also accepts.
Yes.
So it's a self-worth which matters. I'm sorry, ma'am, if I've actually like answered your question, or is there anything more you want to
Yes,
ask?
yes. Basically, it is up to us how to gain the confidence during the conversation.
Yes,
Exactly.
definitely.
No, but
Yes,
what
like
I
anything
feel
else.
is that, during the school days or during the college days, means till the time the child is, not matured enough, is it not like, to make aware the society about what is happening? And, like it is because what we see on their face, that, or the way like they try to, tease us or pull our legs. In fact, that gives more of a low confidence and more of a stuttering. That is what I just wanted to say. So,
Yeah.
if awareness is created, in fact, in the teenage, it will help the children below 18 at least.
And
Yeah.
also, that can be, empathetic related classes, because I mean, schools should start teaching about empathy at a very young age itself. So that actually helps in,
Exactly.
not only in stammering, in any kind of situations.
Exactly.
Yeah,
That's what
yeah,
exactly. Definitely. Not only stuttering, children need to be taught values. They'll become
yeah,
adults. They
yeah,
need to learn to respect another person, irrespective of like how they look, how they speak, how they appear, anything shouldn't define their way of respecting another person. They
yeah,
shouldn't bully another person. They should not tease another person. That is just like goes for anything, being thin or fat, being tall or short, everything.
yeah,
So anything and everything, people shouldn't be bullying or teaching, like teasing. So children need to be taught from their like childhood, at
yeah,
school and at home. Parents, teachers, all of us have a role
yeah,
to
yeah,
teach children not to tease, not to bully. No, all those need to come at the ground
yeah,
level.
yeah, yeah, yeah. Um, and you have any more questions, Manasi, to share? I mean,
No,
to
no, dear,
ask.
I'm done with it. I'm done already. Thank you so much.
Thank you, Manasi. So next question is from the chat, like Siddesh Karambe has asked, can you share the name of the book on pain that you read?
I'll share the
Yeah,
gift of pain. Yeah, I'll just share that.
yes, please.
Gift of Pain by Philip Yancey and Dr. Paul Brandt. The Gift of Pain. Maybe I can chat also.
Yeah, please.
The Gift of Pain. That is mainly about leprosy, not about stuttering.
Thank you. Thank you so much, Neenu. Um, so are there any other questions, comments?
Yes, ma'am.
Hi, Raman.
Yes, ma'am. Actually, I am in Chennai, so I have like experienced that I stammer more in Hindi or my Punjabi language than English. I want to like learn the Tamil language, but it is little hard. So like how you like do like with the stammering or like that, like it is very hard. I want to know, but it's little hard. Like how you please show some light.
So I'm also from Chennai, and actually my mom is Malayalam, dad is Tamil. So people say Malayalam, you don't stutter much because Malayalam is a very slow paced language, has some tune in the musical tone. But in Tamil, it's a very fast paced language. It's like cut and I also find Tamil very difficult. I feel, especially in the pure Tamil, when I read or say, I do stutter more than actually in Tamil than in English. So one thing I wanted to say, Mr. Raman, so yeah, when you learn new language, people say you don't stutter. Many people say when you learn new language, I guess maybe it's like automatically you will slow down your rate, you will think and speak, probably. So that's why I guess. So when you learn, maybe you should try to learn the new language in Tamil. You can watch the movies.
Yeah.
Bollywood movies are nice, so you can, I think, see the
Yeah.
movies,
Yeah.
or maybe even talk to somebody in Tamil. That will also help. Even in this group, maybe you can find people who are from Chennai and
Mm.
try to talk with them. But yeah, because yeah, so Tamil, maybe by talking it might help. Reading Tamil might be difficult because it's a very difficult language, I agree. But if you're really interested in learning, I'm sure sky is the limit. Google is there. You can learn anywhere now. Yeah, I don't know whether I answered your question. Yeah, anything particular you want to know in Tamil or
No,
how to?
actually, am I audible?
Yes.
Yes, yes.
Yes, actually, I work in income tax officer, and these days I am posted in field, so I
Oh,
have to interact with the local people.
understood. Then you need to talk in Tamil, no? Then, uh, yeah, but then English words people will understand. I mean, mix. I think some words maybe you should see which questions you need to use in your field work. Which are the questions? Write it down in English and translate from Google or the friends here in the group and find the words in Tamil. Maybe you can start with that. The main questions which you might be repeating with with each client of yours, no? Because in our medical field, when we do history taking, we know some set questions what you might ask. So we will learn that even in other languages, Hindi patient, Bangla patient, when they come some main words like what is pain. I know Hindi is that, Bangla is beta. So then you just at least with those words, so you can start off like that. I would say you can list down what are the questions you need to include or the terms. So maybe that might help in talking.
Yeah.
Than trying to learn I in Tamil. That is difficult. I think more of talking terms you need to learn. So what are the questions? Write down in English, which are the ones mainly you might need to know. What are the words you have to use about money or something like that? Then maybe all that you might have to see what is the word you have to use for money in Tamil or something like that. And with respect, because our language has with respect and without respect in Tamil, which is unlike English. Yeah,
Yeah.
I think English is very easy in that way. There's no respect, involved. But Tamil has with respect. So that also you can learn how to ask in that with respect. And maybe that's the way to learn.
Yeah. Yeah. Thank you. Thank you so much, Raman, for the question. Do you have any other questions to ask?
Yes, ma'am. Actually, I think actually I am preparing for UPSC also, and my there is a good chance that I will have an interview call for UPSC exam. So I want to know that how to uh, like do some efforts so that I can mm, like uh, like convey what I want to in the interview board because it is very high high stake situation. So I just want to know about this thing. Because in office I am able to uh, handle seniors and all, but when we have some high stake situations, we often stammer more. One thing is we openly disclose it. So apart from it, with your experience, like how to deal with these things?
How to deal with interview or high stress? Interview, I think
Yes,
these are
interview and
yeah, mock interviews are being conducted. No, I see messages many times of mock interviews. I think we should make use of that. And high stress is one thing is be prepared. I would say preparation is the key. No, preparation of the facts, not about stuttering. I'm saying prepare the content. What you need to answer. What if it's like exam, the content you need to be well prepared, first of all. So once you're prepared well, then that solves half the issue. Half the stress is actually gone. So, and your focus also is on preparation, not on your stuttering. And when you know what to answer, I can tell that even in interview, you'll be actually able to answer well when you know what to answer. So you need to prepare with the most asked questions. What are the questions to expect? What the answers they expect? All your homework you need to do. That is very important, especially UPSC is a very, very competitive exam. So and I know lot of like courses are there, YouTubes, many sample interviews are there, question papers, and interview questions are there. So you need to go through all that, and also have the mock interviews, even in the group they make or at home with your friend or somebody. All that definitely helps, because once you prepare something in advance, you've gone through it. So actually, mock interview really helps. So one thing is being prepared with the content and then have some mock. So that mock is for the stuttering part mainly, and preparation is for the content, which is the base. Without the base, you can't build a house. It's like the base is the content. So you need to do your homework well. Which is the best book to use, which is the best site to see. All that you have to find out and finish, all those. Did I answer
okay,
anything
ma'am.
else?
Yeah.
Yes,
Sorry. Yeah.
thank,
Uh,
thank.
yeah. Naveen, you have sent a chat message. Can you elaborate on that?
Yeah, yes. See, since I have given the personality test last year, like I was in a similar situation last year, like focus more about my stammering and its consequences with respect to the personality test. But the board doesn't care. They don't even point out it has some disability or something. They they just tell you to speak, normalize it. They don't concentrate on the stammering aspect of you. They just concentrate on the content you say, the things you say, not the way you say. So for as much as it is concerned, the preparation should be focused on the subject. But since I was focused too much on the stammering, since it is natural, because we have made it so big in our heads, and so the fear part will be there. But the boards in the civil services interview, they are like very matured, and they tend to make things normal. So the mock interviews, they are like very scary, daunting, and also they cause a sense of threat with all the cameras, lights, and stuff. They are like too artificial. So don't judge your performance based on the mocks. Mocks can be counterproductive, like it was for me. But the real interview, stammering, is not at all an issue, I can tell. I got like 165 marks, which was like considering the poor scoring last year, which was like just average marks. But still, with that, the content you deliver there matters, not the stammering to whatever, to the person who is that Raman. Yeah.
Yeah, yeah. Okay, okay, sir. Okay. Actually, I have one senior also who has given the same interviews. I think
Yes, yes, even
two,
yeah, yes, yes.
two
I spoke to people who got selected. Though those selected people, they also stammer. So that doesn't matter at the end of the day. So it doesn't matter at all.
okay, thank you.
Thank you, Naveen, for sharing your insights. And thanks, Raman. Are there any other questions or comments? Mm. So, yeah, I think the audience session is also over now. So with that, we end today's episode. A big thank you to our guest for offering such inspiring insights, and to our audience for your engagement and thoughtful participation. We truly appreciate your time and interest. Thank you so much. Thank you, Neenu. Thanks a lot.
Thanks. Yeah.
Thank you. Yeah.